Millions of seniors are about to lose their Medicaid benefits. That is the big news. President Trump is getting ready to gut Medicaid, and this is going to affect millions of seniors and deny them the ability to be able to pay for things like long-term care, where 50% of all long-term care in the United States is paid for by Medicaid. That's something that a lot of seniors don't know about. And so I'm going to talk to you about these cuts that are coming in Trump's plan to fund his big tax cuts and how it's going to gut Medicaid for seniors and why seniors should be alarmed by these changes that are coming out of Congress. I'm going to talk about food stamp changes that are going to turn the program into a harvest box. That is really, really concerning. It means that a lot of people are going to lose their food stamp benefits because it's not going to function the way it did before. And then finally, stay till the end. There is Social Security increase, $360 a month increase. A date has been announced by the Social Security Administration on when all of this is going to happen. If you are new to this channel, I want to urge you to hit the subscribe button, hit the like button, because all we do is bring you the latest news and update, anything in and out of Congress that is going to affect your Social Security, Medicare, Medicaid, and food stamps benefits. We are the first to bring it to you. So hit that like and subscribe button. Now, before we get started, I want to know where you are watching this broadcast from. Give me your city and state where you're watching us from so that I know, where our viewers, we like to watch where you guys are looking at this broadcast from. So go to the comments and let me know your city and your state. We have a lot to cover today. So let's jump right into it. But before that, a lot of you have been going into the comments and talking about Medicare, the horror stories that you guys are experiencing regarding your Medicare plans. And we are in open season right now. January 1st to March 31st is a short window where you can get into a good Medicare Advantage plan. So we've partnered with Chapter Medicare, and they are the best out there. They have access to all 24,000 Medicare plans, and they're here to help you. They don't work for commission. They're working with you one-on-one to get you the best plan, and they can save you $1,100 on average. So call the number on your screen, 539-205-2147, and get into a better Medicare Advantage plan. Now, let's talk about the big news. So if you've been paying attention to the news, President Trump is getting ready to gut Medicaid. This is going to crush a lot of people, especially seniors, because what people don't realize is that a lot of seniors depend on Medicaid, not only to pay for some of their healthcare premiums and deductibles, but when it comes to long-term care, 50% of all long-term care payments are paid by Medicaid. So let's get into it. So what exactly is happening? Well, let's break it down. The House Republicans have unveiled a budget plan that is going to take $880 billion over the next decade. This represents one of the largest proposed reductions to Medicaid in the program's history. It's going to target nearly 80 million Americans. The cuts are being proposed to help finance President Trump's tax cut, estimated to cost between $5 to $11 trillion over 10 years. The administration claims it will only target waste and abuse, but analysis shows that the cuts will require substantial changes, specifically to Medicaid. So the timeline is the House Republicans are targeting February 24th for a full floor vote on the proposed budget, and then it will go to the Senate. So Medicaid currently provides health insurance for about 80 million Americans, including children, elderly, disabled, and low-income adults. The program costs approximately $870 billion each year, and that is why it's been targeted for cuts. So what is going to happen? Well, 9 states have trigger laws. So for example, Virginia, if they go ahead with these cuts, in Virginia alone, 630,000 people are going to lose benefit because the state has trigger laws. States would need to either dramatically increase their own spending, which they don't have the money, or they have to cut benefits. Hospitals and healthcare providers, particularly in rural areas, depend heavily on Medicaid payment for survival. Any significant cuts will force facility closures and reduce access to critical care in vulnerable communities. Now, states will face increased costs and complexity implementing the new requirements, such as work requirements and more frequent eligibility requirements. These changes will strain state resources while potentially reducing coverage. So what are they planning to cut, and why is it so big? Republicans are considering a nationwide work requirement that will save $109 billion, but will cause approximately 1.5 million people to lose access to Medicaid. The requirement will primarily affect working age adults who aren't disabled or caring for children. Now, what is the cost? The proposal to limit federal funding is based on $900 billion over 10 years. Now, the proposal includes reducing the federal government's contribution rate to Medicaid programs, which will save about $530 billion. And then the plan will limit the state's ability to maximize federal matching funds through implementation of supplemental payment programs, which will save another $175 billion. Now, you're probably thinking, why should you care? If you are a senior citizen, why should you care about these changes? Well, here it is. Medicaid is a joint federal and state program that provides health insurance to low-income Americans, including seniors, disabled individuals, children, and working families. Unlike Medicare, which is purely federal and primarily for seniors, Medicaid covers a range of services, including long-term care and nursing home coverage that Medicare doesn't provide. Currently, Medicaid serves approximately 80 million Americans and costs $870 billion annually. With cost share between the federal government and the state, the program is particularly crucial for seniors as it covers services that Medicare does not, making it an essential supplement to the Medicare program. Services covered include, it pays for essential services like nursing home care, home health aides, personal care services, and medical equipment that many seniors rely on daily. For many middle-class families, Medicaid becomes crucial when their savings are depleted for long-term care that Medicaid won't cover. Now, here's the critical part. Some people are eligible for dual eligibility. So they are both on Medicare and Medicaid. There are 12 million seniors that are eligible, meaning that they qualify for both programs, with Medicare helping them cover their Medicare premiums, deductibles, and services that Medicare does not cover. This dual coverage is especially important for low-income seniors who could otherwise not afford their Medicare cost. What else does Medicaid cover? Long-term care. Medicaid is the primary payer for long-term care in America, covering about 62% of all nursing home residents and being the only program that covers extended nursing home stay. Without Medicaid, many middle-class seniors will be unable to afford nursing home care and will cost typically about $90,000 a year. So when I talk about Medicaid, a lot of seniors are like, oh, I'm on Medicare, I shouldn't care. You should care. You should care about this because they are cutting programs that are essential to seniors in broad daylight. And you can Google this and it's all over the news. They're about to gut Medicaid in a significant way to pay for the Trump tax cuts that is heavily going to benefit the rich. Medicaid provides crucial support and allows seniors to remain in their homes through home care services, personal care assistance, and medical equipment. These services help seniors avoid delay or expensive nursing home care while maintaining independence in their communities. Medicaid helps support family caregivers through programs that pay family members to provide care through respite care services. This support is vital for millions of families struggling to care for elderly parents while maintaining their own jobs and families. For seniors who are exhausted their savings paying for healthcare, who have significant savings, who never had significant savings, Medicaid serves as a crucial safety net, ensuring access to necessary medical care. This program often becomes essential when seniors face unexpected health crises or when chronic conditions require extensive care. So, what are they cutting? Well, they want to cut $880 billion, which will affect seniors, long-term care access, and support services. More than half of all Medicaid spending goes to elderly and disabled beneficiaries. I want to say that again. More than half of all Medicaid spending goes to seniors and disabled beneficiaries, meaning that there's going to be significant pain. States will likely be forced to reduce services, tighten eligibility requirements, or cut provider payments if federal funding is reduced. Cuts could force many nursing homes and home health agencies to close or reduce services as Medicaid is their primary source of funding. I cannot emphasize this enough. If they cut Medicaid the way they're trying to, many nursing homes and home health care agencies will have to close or reduce services as Medicaid is their primary source of income. Rural areas will particularly be hit hard and potentially leaving seniors in these areas without access to necessary care. Now, family financial impact. How is this going to impact you financially? Well, reduced Medicaid funding will shift more costs to seniors and their families, potentially forcing significant choice between Medicare and other necessities. Many middle class families will face financial crisis when confronting long term needs. So let me know. This is serious business. This is happening. This is going to cause a lot of pain. I want to hear from you in the comments below. What do you think about these changes that are about to happen to Medicaid? And do you think it's fair that they are trying to balance or fund the Trump tax cuts on the back of seniors using Medicaid? Vulnerable populations are going to be impacted. More than half of all Medicaid spending goes to elderly and disabled beneficiaries who require long-term care services. These populations will likely bear the brunt of any cuts due to the higher healthcare costs. Children. Medicaid currently covers 1 in 3 children in America and pays for nearly half of all births. Let me say that again. Medicaid pays for nearly half of all births in America. Any cuts would disproportionately affect children's access to healthcare. Working families. Many Medicaid recipients are employed but work in jobs that don't offer health insurance or pay enough to afford private insurance. Cuts will force these families to choose between healthcare and basic needs. And then rural communities. Rural hospitals and clinics are particularly dependent on Medicaid funding to stay operational. Cuts will accelerate rural hospital closures and reduce healthcare access in these communities. So let's talk about it. Here is Steve Bannon, who is a supporter of the president, raising the alarm. Steve Bannon, hospitals join GOP rebellion over Medicaid cuts. This is recent news. This is February the 15th. A division exists between conservative Republicans pushing for deeper cuts and moderate members concerned about the impact on their constituents. Several Republican representatives from states with higher Medicaid enrollments have expressed reservation. President Trump has publicly stated he won't cut Medicaid except waste and fraud. But the program they have outlined in Congress is going to do exactly that. And Democrats are opposed to it, and healthcare industry people are also opposed to it. But this is happening, and the vote is going to happen soon. And this is going to be devastating for a lot of people, and it is a real concern. So, what should you care? Why should you care? Is this something that you should worry about? Well, here is the thing. This is going to affect a lot of people who are not even aware that this is happening. So let's talk about the implementation challenges. New work requirements like verification will create substantial administrative burdens for state and beneficiaries. There may be legal challenges, but they're going to push it anyway because this is part of the plan to fund the 1.5 trillion in cuts so that the tax cuts that benefit the wealthy are going to be implemented, which is part of the 100-day agenda of the Trump administration. Medicaid cuts will significantly affect health providers, potentially leading to job losses and facility closures. The healthcare sector represents a major employer in many communities. Reduced funding could force states to either raise taxes or cut other programs to maintain Medicaid services. And major insurance like Centene, Molina, which specialize in Medicaid managed care, will face significant business disruptions and will lead to disruptions in the market. And here is another thing. Many small businesses rely on Medicaid to provide health coverage for their workers. Cuts will force these businesses to either provide less coverage or lose workers. So what are the alternatives? Some states are exploring ways to protect coverage if the federal government cuts benefits. The Democrats are trying to push back. Some industry people are lobbying to try to make sure that this doesn't happen. And people are proposing a compromise. But because the tax cuts are so dependent on cutting these programs, I don't think it's going to happen. The House is set to vote on February the 24th, with the Senate supposed to follow. States are beginning to prepare contingency plans for federal cuts. This includes exploring alternative funding, and other sources of funding the program. Hospitals and clinics are assessing their vulnerability to cuts and developing response strategies, and various organizations are mobilizing to oppose the cut through grassroots campaigns. So, what can you do? You can call your representative. You can call your representative in Congress and let them know that you have become aware that they're about to gut Medicaid, which provides a lot of support for seniors, and that you are opposed to that, and that you want them to push back. Because a lot of our representatives, if we don't push back, they don't push back. And so, what can you do? You can call your representative and encourage them to oppose these draconian cuts to Medicaid. Let me know in the comment section whether this is going to impact you. Is these cuts to Medicaid going to affect your health care? Let me know in the comments whether you think this is a good idea or not, and what you plan to do about it, how it's going to affect you and your family or people you know that are elderly or disabled or children that depend on Medicaid. Now, let's talk about food stamps. I have been covering this a lot the last few weeks, and it's been gaining a lot of traction. So I want to highlight some of the changes that are coming to food stamps, because a lot of changes are happening really quickly in the Trump administration, and a lot of people are not aware that these things are happening. So let's talk about food stamps. One of the biggest things that President Trump and the GOP in Congress wants to do is reshape the food stamps program and turn it into a harvest box. This was something that Trump wanted to do previously when he was in Congress, when he was in office, and got a lot of pushback. And now he wants to bring it back because the Republicans in Congress want to cut programs, they want to save money. And one of the easiest way they want to save money is to turn the food stamps program from your ability to go buy food with your EBT card to getting a box from the federal government. This is a news article that came out on February 3rd, how the Trump administration could leave families hungry, potential cuts to SNAP in 2025 and beyond. And here is one of the things he said. The largest singular cuts attempted was to withhold a portion of benefits and instead provide recipients a box of non-perishable food. Under the plan, the government would theoretically buy the box at reduced cost compared to sending recipients their full benefits and pocket the savings. However, these resources needed to administer a system that would deliver millions of boxes every month will be unprecedented, inefficient, and restrictive compared to reliability and freedom of having benefits delivered on a card. In addition, SNAP dollars are spent at local stores that benefit the community. This is another article that came out November 6, 2024. It says Trump's budgets have envisioned much more sweeping cuts to food stamps. This last one proposed a nearly 30% cut to the program, including new work requirements on top of an already difficult work requirements in the program, and a big shift to a share of the program into a harvest box, a plan in which household would not get to choose the food they buy, but instead be sent a monthly box of shelf-stable foods that the government picks. This is the Center on Budget and Policy Priorities saying the same thing, that there's a radical restructuring of the SNAP program, and that is coming. Now, here is what back in 2021, President Trump presented that got a lot of pushback. It was going to cut SNAP and change it into food boxes, and that was going to save $123 billion. And now that idea is back in full force as part of initiative to cut benefits. And so here's how it's going to work. About 40% of benefits issued to household will be used to fund this box idea, where non-perishable foods such as shelf-stable milk, ready-to-eat cereals, pasta, peanut butter, beans, and canned food, the box will be in lieu of food that the household would otherwise purchase with that food stamps benefits. And then the other half of the funds will be eliminated. So basically, they would take a huge portion of your food stamps benefit, turn half of it into food boxes, and then the government will not give you the rest. So this is aimed at really gutting the program and saving money by sending everybody a box of food that the government picks every month that you have no choice but to deal with. Another thing they want to do is impose work requirement. The proposal will take SNAP benefits away from adults up to age 65 years old, working fewer than 20 hours a week. despite evidence that such work requirements do not improve employment. So if you are less than 65 years old and you're getting SNAP benefits or you're getting food stamps, your benefits may be at risk because of this new law that is being pushed to try to save money with the SNAP program. They're going to eliminate the link between SNAP and energy assistance. Basically, if you qualify for SNAP, you qualify for energy assistance. If you qualify for energy assistance, low income, and you qualify for SNAP, they're going to break that link so that you have to apply for them separately. And it's a way to frustrate you so that you will not be dependent on these programs and cut a lot of people from these essential programs. Another thing they want to do is, for example, the budget would change SNAP's definition of who an elderly person is. It used to be that if you are 60, you are considered elderly for application purposes for SNAP benefits. They're going to change that to 65, and this will knock a lot of seniors off food stamps. The House GOP is on board. Glenn Thompson, the Republican chair of the House Agricultural Committee, released his proposed farm bill in May. Its most striking provisions will limit the ability of the Department of Agriculture to update its thrifty plan. This was last May, and this is what he's brought back again, and he wants to cut $30 billion from the budget. So what would the harvest box look like? You'll get a box every month of shelf-stable foods, canned vegetables, canned fruits, dried meat, all these things that will be sent to you, and you have no choice, grains, etc. And it will cut 30% of the budget, $30 billion over a decade. Now, when Trump was in office before, he tried to do this, he got pushed back, but now that they have the entire government, they have the House, they have the Senate, and the presidency, it looks like this is about to happen. And if you read the news or pay attention to what's happening in the news, this is in full force. They're about to vote on it next week. What else is coming? There are other cuts that are being planned that are in motion. Let me share them with you. The House Republican budgets will call for $230 billion in cuts to SNAP benefits over a decade through the Agricultural Committee. SNAP currently serves 42 million Americans, including 1 in 3 children. And next week, March 27th, they're about to vote on this, and it's part of an effort to save $2 trillion in mandatory spending that is supposed to fund the $4.5 trillion in Trump's tax cuts that he's trying to pass. So who is affected? Over 42 million Americans receive SNAP. The program serves 11.6% of children under age of 5 and 28% of children between age 5 and 17. Let me read that again. The SNAP program serves 11.6% of children under 5 and 28% of children between ages 5 and 17. So the highest usage rates are found in states across the region, the entire country: Oregon, New Mexico, Oklahoma, Louisiana, Illinois, West Virginia, all are going to be impacted and have very, very big SNAP populations. For example, Tennessee provides a striking example with 800,000 people relying on SNAP benefits across its 95 counties. These benefits not only help families afford food, but also support local grocery stores and farmers market throughout the state. For example, areas like Shelby County, they have 13.4% food insecurity, while 51% of food insecure residents are above current eligibility lines. So I'm trying to show you locally, digging down locally, how this is going to impact communities so that you can see that this is a very, very serious issue and that everybody should be concerned about what is about to happen to SNAP benefits and why, if you care about your SNAP benefits, if you care about your food stamps benefit, you need to be an advocate for yourself, call your representatives, and make sure that they know that you know what's about to happen and that you are concerned. Republicans plan to restrict future updates to the Thrifty Plan. Why is this important? The Thrifty Plan is how food stamps increases are made, significant increases. So by restricting this, they're going to restrict your ability to get food stamps increases that match inflation. So even though inflation has gone up and stayed up, your food stamp benefits are not going to keep up with inflation, and that's a problem. And then the work requirements are going to change. They're going to change state eligibility rules and make it harder for SNAP beneficiaries to reapply or get SNAP benefits renewed. So how is this going to affect people in the real world? Well, the average benefit would drop from the current 6.2%, $6.2 a day under the proposed changes. Think about that. SNAP benefits, when you divide it by day, the average benefit is $6 a day, and it's going to go down further. Working families with children could lose benefits even with modest earnings increases, creating a disincentive for people to get pay raises, because the moment you get a little bit of increase, they're going to cut your benefit. State flexibility. States were able to keep people on the SNAP benefits if there was high unemployment in their states. Now this is going to be restricted, so states don't have flexibility to be able to keep more of their residents enrolled. And then it's going to create a lot of paperwork. Get ready to have to justify why you should be on SNAP. Get ready to have frequent renewal periods. And that's all designed to frustrate you so much that you just give up and quit the program. It's going to affect local businesses. For every $1 that you spend in SNAP benefits in your local community, it creates $1.79 in economic activity. And states depend on SNAP benefits, and obviously small businesses. Approximately 80% of small businesses, actually the people who accept SNAP, if you look at the total population of businesses that take SNAP benefits, 80% are small businesses. And so they are going to be hit hard by this new changes. So here's what this all means. All this is designed so that the Trump's 2017 tax cuts can be made permanent. They need to find $4 trillion, and now they are hitting Medicaid, as I talked about before, and they're hitting food stamps. And I'm sure there are other programs that are going to hit that affect low-income population, that affect seniors. So pay attention to the news. This is happening right now, and you can Google it, and you will see all of it. It's moving so fast in Congress, we can't even keep up. So I've been doing these lives every day to just keep you up to date, because things are moving so fast and they have consequences that are going to be broad and deep and going to affect millions of people and put a lot of people in financial hardship because of this particular initiative to fund the Trump tax cuts. So what should you watch out for? Well, next week they're going to vote on it, and you should expect a lot of floor votes that are coming up. States are fighting back, but I don't believe that they're going to be able to stop this, because the Republicans have the House, the Senate, and the presidency, and they have enough votes to be able to do whatever they want. So I think these cuts are coming. Be prepared for it. If you want to help, call your representative and let them know, your senator, that you're against this. So another change that is coming is that they want to restrict junk food. This is a Fox News article that is talking about the fact that they want to cut junk food from food stamps. This is something that Arkansas Governor Sarah Huckabee Sanders has been pushing. And now that RFK is now in the Health and Human Services position, they are trying to get him to also get on board with this. SNAP benefits, which 23% of it goes to pay for junk food, is the focus. Obviously, their goal is to improve people's lives so that they can make healthy choices. But here's the problem. I've been saying this for a long time. A lot of people spend their SNAP benefits on junk food, not because it's the preferred choice, it's that it's the cheaper choice. So I think right now they're speaking from both sides of their mouth, because on one hand, they're trying to cut SNAP benefits. On the other hand, they're trying to restrict junk food. And people don't buy junk food because it's what they love. It's just that sometimes it's the cheapest, and healthy food is expensive. So if you want people to make choices and you want to incentivize them to make healthy choices, then give them more benefits, increase the benefits so that they can afford to buy healthy food. But to cut benefits at the same time saying that they shouldn't buy junk food is really going to put people in a position where they cannot afford to buy food to eat. So this is coming. There's a lot of data out there that, SNAP benefits are used to buy junk food. But the point is that people on SNAP are not buying junk food in any different percentage than the regular population. So this is not as if it's a unique problem to SNAP beneficiaries. It's a national problem. And to isolate people on food stamps and try to force them to buy healthy food when you're trying to cut their benefits, I don't think it makes sense. So by the way, but this is coming. It's one of the changes they are trying to push through. So pay attention to it. And then states are also going to lose the ability to really have flexibility to keep people on food stamps in areas of high unemployment. And so if you are on food stamps and you've gotten waivers, your interviews were waived, maybe your renewal period for food stamps was extended, all these are going to start going away. And then work requirements are going to be tightened. So if you're a senior, get ready to work up to age 65 to get food stamps, because that is what is coming, and is coming fast. Another change that is coming is summer EBT. This is a permanent program that is happening, and it is supposed to help kids that were getting school breakfast and lunch, reduce breakfast or free breakfast, and during the summer months tend to go hungry or don't get enough nutrition during the summer months. So this program, called the summer EBT program, is going to give each child $40 a month to help pay for their nutrition during the summer. So if you have 3 kids, you're going to get, $120 per month to buy them food. It's a permanent program, and states have to opt in. And so far, majority of the states, a large majority, are doing it. It's going to help 29 million kids this year on a permanent basis. So this is one good news that is coming out of all of this. And then SNAP fraud is also growing. I cannot emphasize this enough. The amount of fraud that is in the SNAP program, in terms of people stealing other people's food stamps, scheming, you get your food stamp benefits deposited into your EBT card, and then it's stolen, because fraudsters have mastered stealing food stamps from SNAP recipients. And part of the reason is that the food stamps cards are not that sophisticated. They don't have the chip technology. And so it's easy for fraudsters to replicate the cards and steal benefits. And this is something that states are going to start dealing with by issuing chip-enabled food stamps EBT cards. That is one of the changes you're going to see in 2025, where your food stamp EBT card is going to be replaced. New York has started it. California is working on it. You're going to see a lot of changes to protect your food stamps benefits. And I think this is another good news in a sea of bad news that I've been sharing with you. So get ready to see changes coming that are positive to help you secure your food stamps benefits. So I want to hear from you. Let me know what you think about these changes to food stamps. Do you think it's a good idea? Do you think benefits should be cut? How are these cuts going to affect you and your ability to afford food? Let me know in the comment section below. And also, if you're still watching this broadcast, hit the like button, hit the subscribe button, and I want to know where you're watching this from. So let me know your city, let me know your state. I'm really looking forward to learning where everybody is watching this broadcast from. So go to the comment section and let me know. And then finally, let's talk about Social Security fraud. Elon Musk has been on a tear and is trying to find fraud in the Social Security program. He said it's a $50 billion issue. It's a $100 billion issue. And we don't know where this is going. But now he has access to Social Security benefits. So the headlines have been all over the place. Elon Musk, they say there's a $50 billion fraud, and he's everywhere looking at everything. But what do you think about that? He said he's trying to eliminate fraud and waste, but I think it's disguised to cut spending. So let's look at it. So my understanding is that Elon Musk, through DOGE, has made headlines claiming that he has, found extensive fraud in the Social Security program. They've created this new department that he's in charge of, and they've been looking everywhere. But what are they trying to do? Well, the thing is that he has read-only access to systems, and he's looking at all these payments, and he's claiming that he's found $100 billion in Social Security fraud. He's found 150-year-old recipients that are getting Social Security benefits. And my take on it is that if he's found all these fraud, why are they not pursuing this and prosecuting the people that have committed this fraud? Because if there's indeed $100 billion in fraud, why are they not arresting people and prosecuting them? If people are 150-year-olds who are obviously deceased are still being sent payments and somebody's collecting it and cashing it, why are they not arresting people and prosecuting them? So I am very suspicious that this claims of massive fraud in the Social Security program, because he has not shown any evidence of fraud, even though he keeps claiming that. So what does he want? He wants all these changes. He wants to change the payment tracking code. He wants explanation for every payment, even though that already exists. He wants the do not pay list updated. And here's what concerns me the most. He wants them to move the treasury data to their private servers as Tesla and X for analysis. I feel like this is bananas, because no other private citizen would ask the government to send them the government data so that they can analyze it on their own private servers. I mean, it's extraordinary power, and I believe this is a pretense for cuts to Social Security and Medicare. Even though they keep saying they're not going to do it, I think it's a pretense to do that because it does not make sense. But let me share with you why I don't think it makes sense. Number one, if they found fraud, show it to everybody. Because the Social Security system is already audited by the Office of Inspector General. And they did an audit recently, which is required by Congress, that they have to submit to Congress. And over a 5-year period, they found 71.8 billion in improper payments. That is less than 1% of all Social Security payments. And compared to other government programs, this is actually one of the best in terms of the extent of fraud. But Elon is claiming that he's found 100 billion per year. The government is claiming, based on the Inspector General's report, 71 billion in 7 years. So who is right? Well, the Inspector General publishes their report to Congress semi-annually, so it's out there. They have shown their work and shown what they found. I think Elon should do the same thing. Show us your work. Show us the names. Give us who is getting money improperly. And currently, you can also report fraud. If you know somebody that is cheating the Social Security system, you can report it right now. It's been around forever. And these are the categories of people you can report. People who are misusing Social Security or benefits, people who provide false and misleading information to begin or continue receiving benefits, people who are hiding eligibility factors such as work, earnings, disability, and other living arrangements to get benefits, or people who are misusing or fraudulently getting benefits. You can report them right now. This has been around for a long time. But my point is that the Office of Inspector General publishes their report. It's required by Congress. Here is the latest report that I pulled from September 30th, 2024. So if Elon Musk has found staggering fraud, as he claims, he should just share it with the whole world so that we can know who is being paid, and they should be arrested and put to jail. I think everybody will support that, because I am all for fraud being eliminated. I'm all for waste being eliminated. I'm all for abuse being eliminated. But we cannot hide and make wild claims that fraud is happening and we don't show evidence of the fraud that is happening. So that is my only problem with the whole thing. And the fact that they are not experts in running government programs, but they are programmers, it's not necessarily a bad thing. It's just that if you found something that professionals who have been doing this work, big accounting firms have been auditing the Social Security Administration, if they didn't catch all this massive fraud and you found it, then it's good news. Share it with everybody. So I want to hear from you what you think about Elon Musk and his access, because the Social Security, the one of the high-ranking Social Security officers quit today because Elon wanted access to everybody's Social Security record, and he pushed back and he quit because he thought it was not necessary to get that kind of access in order to do the work that they're trying to do. So why do they need everybody's Social Security information, including your Social Security number and everything? I think there is something else that is going on that we don't know. And So that is what I want to talk about today. That, look, I want to be clear. I am not against what Elon Musk is doing. I just want him to show his work. Show us the fraud. Don't just make wild accusations that there's 150-year-olds that are getting social security checks. Obviously, it's going to somebody and the person is cashing it and has been probably doing it for years. Why don't you just share the information with us so that we also can know and trust that he's indeed in there to eliminate fraud, waste, and abuse versus getting all our data and using it for purposes that may not be good under the pretense of trying to root out fraud and abuse. So I've covered three things today. I have covered the Medicaid cuts. I want to hear from you about that. I have covered food stamps cuts. I want to hear from you about that and how that's going to impact you. And I've covered this DOGE Social Security challenges where I think in trying to eliminate fraud and abuse, we need to see the evidence so that we can all follow along on what they're trying to do. So I want to thank you for joining me today, this evening. Let me know your thoughts in the comments. I just report things that I think will benefit seniors, that seniors should be aware of, things that are going to impact your Social Security, Medicare, Medicaid, and food stamps. So let me know your thoughts. And if you have any news that you think goes against what I'm saying, or you have anything better to share, or you have information that I don't have access to that you think will help us all understand what's happening, please share it in the comments. We all want to learn from each other, but this is what my research has shown, and I'm bringing it to you. So thank you for joining me tonight, and I will see you on another live tomorrow. Good night.